The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. I have back with me on a returning guest. Great episode today. Can't wait to jump right into it. Let me just go ahead and get the introduction done. Dr. Chris Phelps, say hello.
Hey, how's it going?
It's going great. Great to have you here. Always love it when we have a doctor come on the program. I know you started the Phelps Institute and you're helping practices all over the country. You can certainly learn more about Dr. Phelps on our website, or of course his website, thephelpsinstitute.com. But I want to jump right into our episode. There's going to be a lot to unpack today. I got to say first, congratulations. You got a new book out in September, complete book on dental marketing. Congratulations on that. Why don't you tell us a little bit about the book?
Thank you. Yeah, it's 20 years of my life in dentistry all wrapped up into one thing. At the time, all these things swirling in my head, lessons learned the hard way, really came about from probably about 12 years ago when I had sold two of my best practices that I had at the time and took over my two worst practices. Found myself spending $36,000 a month in dental marketing between the two offices to only get 60 new patients for my efforts, 30 at one office and 30 at the other. And so, you don't have to be a math major to realize that's not a good check to write every month. And something is going wrong, but I didn't really have the help I needed or the expertise to guide me to figure out what that was. So unfortunately, like a dog with a bone at the time, I had to dig into it and figure it out. And so, I tried to write the book as a way to teach doctors what I had to learn the hard way and hopefully help them avoid some hard lessons learned.
Yeah, and there's a lot of pain out there, and for sure in this subject. I know the book's available on Amazon, complete book on dental marketing. I want to get that out there multiple times because I think it's a must read. And having some experience in this field myself, I know just how much money, or have an idea of just how much money is wasted on quote marketing that doesn't work. Is that your experience? Do you see that happen often?
Yeah, no doubts. And there's so many factors, what I kind of call the 7 pillars that tie into that and is the root cause behind it that more people need to be aware of.
Yeah, let's jump into these 7 pillars. What's pillar number 1?
Yeah, the first one for me is always know your target market, right? You got to know who you want more of into the practice. In my persuasion trainings that I give for offices, I show this video of people who show up for what they think is an experiment. And they fill out a piece of paper to the experimenter, and then the experimenter is kind of behind a counter that's kind of above their waistline. They drop down behind this counter so you can't see him anymore. And then a totally different person stands up, says goodbye to them, and points them to a different room. And when surveyed in the next room, 75% of the people have no idea that a totally different person was talking to them, right? That there were 2 different people there, right? They see it just as the one. This thing called change blindness. And really what that shows us is our second pillar, which is not only do you need to understand who your target market is, because we're so distracted, because we're so busy nowadays with all these things in our to-do list and whatever, we're scanning everything. So when we barely listen to something if it's on the radio or the TV, we're barely reading it, and if it's in front of us in some kind of print medium or whatnot. So ultimately, we scan everything. And so if your message, right, your target message to your target market doesn't grab them, their focus and attention and stand out, then you have no chance to influence them your direction. So we got to spend some time on strategically creating these headlines of our story, our messages, which is our second pillar. From that point on, once we know who our target market is, what our message is, then we can start looking at things like, well, what's the content of this thing now going to be? What's the story, if you will? And is the story more like, are we trying to create emotion with this story? Because, we can use pictures and other things, sometimes even colors to create emotions and stories. Or are we really trying to target them at a specific stage of where they are and what they call the consumer buying cycle, right? Somebody who doesn't even know they have a problem, so it's an awareness phase. Somebody who wants to know what their options are, so they're in the options, fact-finding phase. Or somebody who's just looking for the best person out there, right? The expert to do the work for them. Your marketing content can actually be targeted specifically depending on what type of patient you're looking for. But ultimately, what really kind of defines those kind of 3 things will help you with the quantity of calls that are generated. Or interest, if you will, from any kind of marketing piece. But ultimately, it's the offer that you put out there is going to dictate the quality. Quality for me is someone who spends my full fee, not looking for to give it away for free, if you will, and someone who's going to be a return spender, right? Be back in my chair in 6 months. So what kind of offers can we strategically put out there that breed a better quality patient, which is key, you know?
Yeah.
And,
Sure.
you know, so that's kind of our fourth one. And then, of course, we've got all these things. Well, how do we add more of the science of influence and persuasion? Because, again, if we can grab more of their attention and influence them better, and we know the triggers that influence them, more people come our direction. Then we can finally get to what medium are we going to use as our next pillar, right? Because you can do things from an external marketing, things that cost more of your money, but don't really cost your time. You kind of pay people to do these things, all the way to the other end of the spectrum, things that cost more of your time, but doesn't take a lot of your money. A lot of these grassroots kind of marketing events is what I cover in the book. And then everything in between. And then, of course, our last pillar, of course, is once we've done all this, how do you track this stuff, right? What are the 5 most important things you need to track to know your marketing's working or it's not working? And in my case, when I'm spending $36,000, I knew it wasn't working, but I didn't know why. So, and you have to know that why so you know what to do next.
Sure. Yep. Makes sense to me. So there's a lot to unpack here. I want to first start with that tracking piece, because it is really, really important. I personally believe a good amount of advertising doesn't work because we don't stick with it. Right. So I like to say, like, you know, it's like saying if you want to lose 20 pounds, if you just eat a salad today and go to the gym tomorrow and then eat pizza the rest of the week, you're not losing 20 pounds. Right. There has to be some type of consistency with what you're doing. And that's one of the things that I see that people do that fail often is they try something once, it doesn't work, and they don't realize they need some type of repetition, some type of reach. Because like you said, getting millions of messages a day, it's, I think, 7,000 or 10,000, depending on who you listen to. So that's important. But something else that I want to talk about a little bit too, and you led into this, there's a big difference between your actual advertising and marketing, right? They're 2 separate things, aren't they?
Yep. Yeah, big time. Yep. And as you said, that tracking thing is absolutely key. Like, so in my case, you know, like my team, when I was spending like $14,000 a month on radio ads, and I'd ask my team, well, how do we do? Right? How'd the ad do? And their response was, we got a couple calls. So in my head, I'm thinking, a couple calls, 14,000. Well, that's not good. So when I started tracking it, come to find out, we actually got 20 calls from the radio ad directly. We didn't answer 12 of them, and we only scheduled 2 of the 8 that we did talk to. So there was your couple of calls right there. And so, I mean, tracking is key, and understanding that, you know, there's a spectrum, right? This marketing and advertising world is a lot bigger than we think it is.
Oh yeah. Yeah. So when it comes down to tracking, when you are investing a significant amount of money, I totally agree. You have to be tracking, but you don't want to just track on a scratch pad, right? You want to use things like actual call tracking numbers. You want to use landing pages or web forms or even specific offers that people come back in with. So you know exactly what it is, correct?
Definitely. You have to be as specific as possible. So I mean, at one given time, I had like 50 different call tracking numbers out there, every one of them unique to what was going on. I had unique landing pages built out for all of my different online advertisings or things that it would be hard to tie to, like a billboard ad, let's say. So you knew exactly who was coming from this thing that was static, that was just sitting there. And for me, that was the only way I could get to the truth of the whole truth, if you will, about what was really going on.
Yep. So in your experience coaching and consulting with practices and dentists across the country, when you click on that call tracking, you help them get set up on call tracking, right, where they are monitoring everything coming in. Do you typically see the amount of new patients go up immediately just from the call tracking and no other forms of advertising? In other words, once it's being tracked, doesn't it seem like every call is now being answered or being followed up with? There's now follow-up systems in place, as opposed to a scenario that I see from time to time where you get 16 phone calls that didn't get answered. And you know that they were tracked, they came in off the piece, but nobody answered them. Do you see that scenario?
Oh, yeah, definitely. Like in my own instance, why was I spending so much money? Well, we did not answer 254 marketing-based phone calls a month between the 2 offices. Yeah. And when we did answer, we only made an appointment 24% of the time. So the first thing I did was, when I got the call tracking stuff in place and let my team know I'm going to be listening, so to speak, right, to all these calls, instantly, literally the next month, their conversion rates doubled. Right. So just adding that little accountability piece in, and I've seen that happen with offices all over the country. As soon as people know there's some accountability there and people are listening, right? Good or bad, however they feel about it in the moment, their results have nowhere to go but up.
Makes sense to me. In your experience, and working with practices across the country or in your own practices, what does that first patient typically spend on average when they come into a practice?
If I find it's different among different practices. Like for me, because I targeted to sedation patients who needed full mouth
Sure.
work in general dentistry and some of the specialty procedures such as implants and endo, versus my general dentistry patients. And my sedation patients were worth like $3,500 minimum spend in the first year. Okay. Versus
Right.
my general
Right.
dentistry patients were worth about $1,254 in the first year. Either way, both
Sure.
are significant, but we build our budgets around that.
Right. So when you run an ad and you spend $1,000 on an ad, and that ad, let's say, generates 10 phone calls that you don't answer, that's not worth $1,000, right? That's
Right.
that's how much it cost you out of pocket. But the revenue that you missed out on can be as much as 30, 40, $50,000, right?
Big time. Yeah. So it helps you start
Yeah.
seeing lost opportunity and just how much, many thousands of dollars that stuff is costing us every month.
Yeah. So let's go back to the beginning part of the first pillar, which, and I'm paraphrasing here, was identifying a target audience, right? Having
Mhm.
your niche audience that you're gonna target, and that makes a ton of sense. Shooting fish in a barrel, right? And I know we don't probably like to use terms like that in the healthcare industry, but it is. It's easier, right, to cast a net in a smaller pond, if you will. You can get more reach in front of people. It makes a ton of sense. But how do you go about choosing that? And this is why I'm asking that question. I think most people that are listening right now, based on dentists that I talk to, are like, oh, I want people that, are professional, that, make a ton of money, that, can pay for whatever they want, and they have a BMW and a nice house. And it's usually very income driven, right? Or demographic driven based on economics. That's not always the best thing to do, is it?
No, definitely not. And again, it all goes back to asking yourself, you want to be as specific as possible and as selective as possible of who gets in that chair, right? And so
Right.
if it's a sedation patient, for instance, well, one of the easiest ways I could tell who my target market is for this specific type of niche procedure is going back and look at the ones who've already done it. In essence, going back and
Sure.
look at my last 20 sedations and say, who are these people, right? What do they look like? And I'm trying to categorize them, and not just one thing like income, but in as many categories as possible. Are they male? Are they female? Are they working? Are they not working? As many of these little
Yeah.
boxes I can create and categorize them. Do they all live in the same place geographically? Or where can I find them? Where are they all hanging out? Where are they all shopping? Where are they all looking for their information?
Right.
And ultimately, I'm trying to find at least a couple of categories that I can find a pattern in. And once you find the pattern, then that kind of gives me an idea where I can find more like them.
Right. Yeah. Now, I want to kind of clarify something here and say this and just kind of take it to another level, I should say. If you're a pet lover, right, this has nothing to do with the income demographics, but you have 3 dogs and 2 cats, and you spend your time, your free time on the weekends at the animal shelter, volunteering, it's probably a pretty good idea to market to animal lovers if you can find them and let them know that you're an animal lover, right?
By far. There's one of the principles I talk about from Dr. Cialdini called the liking principle. And ultimately, we like to do business with people we like, right? So people who
Yep.
have who are like us in that sense, who have commonalities and similarities, we are drawn to them because we see ourselves in them. So in my advertisements, for instance, I would often put that, pictures of me playing tennis. Okay. Because I'm a tennis player, right? I
Yeah.
grew up playing tennis.
Yep.
It's a passion of mine. My kids play tennis. So I would do that. And I can't tell you how many patients came in and said, well, I saw you play tennis. I play tennis. Hey, I love the fact that we
Right.
already had something in common before we ever met. That's why I'm here. I'm like, wow,
Right.
really? Dang. All right. Glad I
Yeah.
put that in there.
Yeah, 100%. And going back to the pet lover thing, if you're doing direct mail, you're interested in it. There's a lot of different strategies that work that can be really effective in direct mail. But if you love animals, you can actually buy a list of people who have donated to animal related charities in the last year within your area. And it costs you a little bit of money to do this, of course. And then you can put a postcard in front of them that says, Dr. Phelps loves animals, and for every new patient that comes in with this postcard, we'll donate $50 to the local animal shelter. And then your response rate to that is going to shoot through the roof. Would you agree with that?
Oh, definitely. Like I said, the more you know about your
Yeah.
target market, remember, birds of a feather flock together. So when you can find others like
That's
them
right.
and target a list like them, even better.
Yeah. So, and this is, I'm guessing there's some secrets in the book. I'm going to ask you for a secret right now, and just remind our guests again, it's the complete guide, the complete book on dental marketing, Dr. Christopher Phelps. It's on Amazon. Recommend grabbing a copy. I will be reading this book. I have not. So let me ask you this kind of final question. What's a little secret that you know about advertising? What's a little a way to get in front of some people kind of effectively and efficiently that maybe a lot of people aren't doing that you'd care to share with our audience?
Yeah, well, it goes back to knowing that market medium message. And my recommendation is this: when your target market is sitting in your chair, okay, when you obviously, like for instance, the story I tell is I had a patient that I'd done 2 implants on. He was coming in for his post-op check. He was an active independent living retiree, which is my target market. Somebody I was targeting others in their community to buy my dental membership plan. He had paid cash for his implants. Yeah, if I want anybody else in the chair, I want more like this guy, right? And I just happened to be talking to him and asking him questions about being retired. And he told me, I kind of asked him, I was like, Bill, what do you do every day? I bet you're just sitting around the house doing nothing. And he's like, well, Doc, every day I get out of bed and check the newspaper, I look in the obituary section. And if I'm not in there, then I keep on going. And so, it was a nice joke I got out of the guy, which I thought was hilarious. And telling one of my associate doctors that story after the fact, it hit me. I was like, hang on a second. What did my target market, even though he was kind of joking, he was kind of not joking, just tell me he looked at every single day, not just the newspaper,
Obituaries, yep.
But the obituary section of the newspaper. And so I called the newspaper up and I put a small advertisement in there, and it got me 100-to-1 return for my investment in the first friggin' 2 months. Okay. And I stopped counting after that. So when your target market speaks, guys, they're giving you hints. So your world should slow down. Ask them a million questions and look for those patterns. Look for the 1 or 2 connections is all you need. And it will give you insights into not only those messages that will draw these people in, but also the mediums that you can put that message to give your the best chance to get them in the door.
Yeah. And one of the things you're doing, I mean, it's brilliant. One of the things that you are doing is you're starting to advertise in a place where your competitors aren't, right? So if no one's thinking, hey, put an ad next to the obituaries, right? Your competitors aren't there. You stand out, which is getting harder and harder to do. And you're reaching your demographic, your audience at the same time. So brilliant advice. And I think that carries out to a lot of things. One more time, the book, it is the complete book on dental marketing. Grab a copy on Amazon. Check out the website. Ton of information on there. The Phelps Institute. Dr. Phelps, thank you so much for being with us today. We really appreciate your time.
Thank you.